diagnostic test for ulcerative colitis. Ulcerative colitis is a chronic inflammatory disease of the bowel, large gut, that is colon, which produces inflammation and the ulceration of the mucosa and the submucosal layers of the large gut. The symptom produced finally is loss of weight due to loss of appetite, anemia, malaise, fatigue symptoms. In addition, we have to diagnose this miserable disease, though it is a rare one, but it makes the patient unsocial due to frequent urge for incomplete defecation. Bloody and the mucus stools are passed. Now, first of all, we take the history of the patient, about his bowel movements, tenesmus, pain. Then we go to the laboratory test for complete blood picture test. In that we examine hemoglobin level, percentage, PSR. Next we have to electrolyte balance, sodium, potassium, iron, and the reactive C protein level. Then we perform the stool test for RBC, WBC, mucus debris, and the bacterial debris, and the cut blood in the fecal test. Routine KUB abdominal plain X-ray of the abdomen is performed. Next is the variant meal X-ray series. They are helpful for detailed study of the inflammation and the ulceration and extent of the disease, starting from the rectum and the colon, different parts of the body. It is a remarkable and hallmark of the disease that it starts from the inflammation of the rectum, then go onward to involve the various parts of the large intestine, colon. In Crohn's disease, rectum is never involved, and in Crohn it spreads from the mouth up to the large intestine except rectum. But here in ulcerative colitis, the inflammatory process starts from rectum, ends to the start of the big colon. I mean the big intestine, gut or the colon, near the hygiene. So this is the differential diagnosis between the ulcerative colitis and the Crohn's disease. Now, ultrasonography abdominal, that is also performed to study the details of the ulcer, their distribution, extent, shape and size, inflammatory process, and also the various strictures, polyps, and the various pathologies they are produced in the passage of the large intestine. The most reliable test, the special test for this diagnosis of the disease, that is the colonoscopy. Colonoscopy is a process by which a flexible tube fitted with the video camera is passed through the anus, upwards, rectum, and the various parts of the large intestine. So by this procedure we can visualize the anterior of the whole large gut of the colon, starting from rectum up to the end of a start of colon. This process is not only diagnostic but it is also a therapeutic value to the procedure. Because by this procedure we also take the various pieces from the areas suspected of the large gut for study, histological study in the liver to detect the early detection of early start of the colorectal carcinoma. Because if the disease is progressive for beyond 10 years, there are more chances for colorectal carcinoma. So this procedure, biopsy, we can do the early diagnosis of the start of the cancer so that the early treatment can be performed for the good prognosis of the cancer. So this procedure, which is called as the colonoscopy, sometimes it is performed up to a limited part of the large colon, that is sigmoidoscopy. When only the rectum or the sigmoid colon is involved, then it is only the lower part is visualized, and that is termed as sigmoidoscopy. When it is whole pancreatitis is involved, then we perform the full colonoscopy. So this is a very reliable, very beneficial one. Usually the patient try to avoid this procedure. It is not a painful, it is performed under the injection of the sedation is given to reduce the pain and the tension of the patient.